OET speaking, sample test 5, foot odor, podiatry. You see a 27-year-old patient who plays a lot of sports and is concerned about foot odor. You have just examined his or her feet. Find out more details about foot odor problem, onset, frequency, if other areas of body affected, etc. Find out further relevant details, type of shoes or socks usually worn, foot hygiene, etc. Give results of examination, no signs of infection. Give sweating as likely cause of foot odor. For example, bromodosis, buildup of sweat, bacterial growth, bad odors, smell, etc. Find out about any treatment tried. Recommend treatment, for example, antiseptic solutions, topical antibiotic, etc. Advise on prevention, for example, well-ventilated shoes, changing shoes and socks regularly, moisture-wicking socks, etc. Emphasize likely need for ongoing management, for example, potential problems of uncontrolled foot odor, more prone to infections, athlete's foot, etc. Patient roll card. You are 27 years old and play a lot of sports. You have noticed that your feet smell after exercising. You have come to the podiatrist for help with your foot odor. The podiatrist has just examined your feet. When asked, say you noticed that your feet started smelling a few weeks ago. You think it's worse on hot days and during sport, but you're not sure. Your feet sweat a lot, more than anyone else you know. It's only your feet that are affected. When asked, say you wear sports shoes and sports socks most of the time. You shower every day and you wash your feet in the shower. When asked, say you haven't tried any treatment. You weren't sure what to use. Say you hope that the treatment will start working quickly and that the odor will go away soon. Say you'll try those suggestions for treatment and prevention. You hope the problem clears up. Well, Bob, I've just examined your feet and I'd like to ask you a few more questions about your foot odor problem. Is that okay? Yes, of course, that's absolutely fine. When did you first notice the smell from your feet? My feet started smelling a few weeks ago. I see, a few weeks ago. And how often do you notice the smell? Well, I think it's worse on hot days and when I'm playing sport, but I'm not really sure. I see. So you think it might be worse on hot days and when you're playing sport. Are there any other areas of your body affected? No, it's only my feet. My feet sweat a lot. They sweat more than anybody else I know. It's a bit embarrassing, to be honest. I see. Only your feet. Well, that's good to know. I know it can be embarrassing, but try not to worry. I'm sure we can find a way to stop the smell. Let me ask you a few more questions now, if you don't mind. Sure. What type of shoes do you normally wear? I normally wear sports shoes. I have some running shoes and some tennis shoes. Okay, sports shoes. And what about socks? I normally wear sports socks most of the time as well. That's good. And what about your foot hygiene? How often do you wash your feet? Well, I shower every day and I always give my feet a good scrub in the shower. I see, you shower daily. That's great. Let me give you my results of the examination now. Okay. The good news is that there are no signs of infection, so that's good. I think sweating is the likely cause of your foot odor. I think there's a buildup of sweat, and this can cause a bacterial growth, which leads to a bad smell. Have you tried any treatments? I haven't tried any treatments at all, no. I wasn't really sure what to use. I see, you haven't tried anything. That's okay. Let me recommend some treatment options to you, Bob. Is that okay? Sure, that would be great, thanks. So, I recommend using an antiseptic solution, and you can also use a topical antibiotic, both of which you can put on your feet. Are you following me? Okay, so an antiseptic solution and a topical antibiotic, that's fine. I'd also like to advise you about how to prevent your feet from smelling. I recommend you use well-ventilated shoes, and it would be a very good idea to change your shoes and socks regularly. Are we on the same page? Yes. So I should wear well-ventilated shoes and change them often. That's right. You could also use some moisture-wicking socks. These are very effective and will help with the moisture problem and can be very useful to prevent your feet from smelling. Okay, moisture-wicking socks. I'll buy some today. I hope the treatment will start working quickly and that the smell will go away soon. I hope the smell will go soon too, but you need to make sure that you continue with it until the issue is resolved. Otherwise, there could be potential problems of uncontrolled foot or odor, and you might be more prone to infections like athlete's foot. Is that clear? Yes, that is clear. I'll try everything you suggested today, and I hope the problem clears up. That's great, Bob. So, just to summarize before we go, I'm going to recommend you use an antiseptic solution and a topical antibiotic on your feet. I also recommend you wear well-ventilated shoes and change your socks and shoes often, and also use some moisture-wicking socks, and try to keep an eye on the odor and keep up with the treatment on a daily basis. Do you have any questions about anything? No, I don't have any questions. Everything is crystal clear. Thank you. Best of luck with everything, Bob. I hope your feet get back to normal soon. All the best. Bye-bye. Now it's your turn to practice. Pause the video and practice. Please like the video to help me build this channel for you. Thank you for watching. Good luck with your studies. Stay motivated. You can do it.